Hi, thank you for taking the time to watch this presentation on substance use disorder detox. My name is Isabel Andreasen, and I'm a doctor of physical therapist student at the University of Kentucky. If you've made it this far, you're in the right step to your recovery. So what is detox? So as we know, drug dependency produces significant and lasting changes in the brain chemistry and function. So once you start taking a drug, it can be very difficult to stop taking that drug because of the rewiring that happens in the brain. However, the good news is we have learned throughout research that neuroplasticity is possible and you can rewire your brain for the better. So, when you stop taking a drug, there will be a period of withdrawal that can cause unpleasant emotional, physical, and behavioral symptoms. It's very important to know that some withdrawal symptoms can be life threatening, and safe detox will help eliminate the risk and get you to the next level of recovery. Also, being informed on detox and the process will help you get there as safely as possible. So why is detox important? So again, when withdrawal symptoms are not managed effectively, chances of relapse significantly increase, and sometimes that can include deadly overdose. And as I mentioned before, it's very important that you're detoxing in the correct way because some detox processes are fatal. So detoxing. So it's very important to know and understand that detox is going to vary from person to person, and it's going to depend on the drug, the dose, and the duration of the substances or substance that was used. So your detox may look very different from your neighbors, one of your friends, or somebody else. Medical treatment in a controlled environment can help manage symptoms and increase chances of success. That does not mean that you have to go to medical treatment. It is possible to do at home, which we'll discuss. It's very important that you get rest and plenty of fluids because dehydration is a main concern, and that could lead to being hospitalized. And then for those of you who maybe have detox in the past or your drug addiction is not as involved, there may be mild symptoms, and you may want to talk to your doctor about NSAIDs, Imodium, and Vistarol to help ease the symptoms of body aches, diarrhea, and nausea. So some things to be aware of, the signs and symptoms if you've experienced opioid withdrawal. It comes in 3 phases: early, peak, and late phases. In the early phases, which typically happens within 24 hours of stopping, you may experience muscle aches, restlessness, anxiety, runny nose, excessive sweating, inability to sleep, excessive yawning, dysphoria, hypertension, and racing heart. So just be aware if you're experiencing any of these, know that that is normal. Then there are the peak symptoms and the late symptoms, which typically the peak is going to be within 72 hours and that can last up to a week. So know that you can get through it. It just might be a week. That's a little brutal. Those symptoms include diarrhea, abdominal cramping, goosebumps, nausea and vomiting, depression, and then a strong drug craving. But know that if you can get past this week, you are on the right path. You can do it. It will be tough. No one's going to lie to you and tell you it's an easy process, but it is the right thing. And the fact that you're listening now is a good step. So types of detox, there are many types. So one is unassisted withdrawal is not life-threatening. However, it is more comfortable and decreases your chances of relapse if you go get assistance. But again, opioid withdrawal is not fatal. Residential medicated treatment, they provide both pharmacological and psychological treatment, and they have close supervision. This typically is about 5 to 7 days of treatment, and you'll be perhaps prescribed some medications to help you taper down off of your dosage of choice. Some of that can include buprenorphine, norepinephrine, a few others, but not everybody receives that, so that's only something that you might experience. There's also a medicated outpatient, which is intensive outpatient basis, and you will receive medication of some sort. And then the last approach is the non-medicated residential treatment, which is the cold turkey approach. So for anybody who maybe has a fear of getting addicted to another kind of drug, this may be the right step for you. You may just want to go cold turkey, stop all the drugs, and then be on your way to recovery. Another type of drug that we want to talk about is meth detox withdrawal symptoms. So, meth withdrawal is also not fatal. However, some of the symptoms that you should be aware of that you might experience include fatigue, increased appetite, excessive sweating, paranoia, hallucinations, dehydration, suicidal thoughts, and depression, and then sleep disruption. So, a lot of people really struggle with sleep in the beginning. So, that's just something to know. The different types of meth detox, one is the inpatient medical detox, which is the preferred method. Here, they're going to monitor your vital signs around the clock. You will have medical assistance, medical treatment. However, with meth, there are no drugs specifically designed for your withdrawal symptoms. So, like with opioids, you can get buprenorphine. There is nothing like that for meth. However, a lot of times you may be prescribed an antidepressant, an anti-anxiety medicine, or even a very mild stimulant just to help you if the medical team decides that's going to be best for you. And again, you can also detox at home. It is not fatal. It's very important, though, that you increase your fluid intake and you get plenty of rest just to prevent any type of dehydration. Now, the main one, alcohol and benzo detox. This one is super important to know because the withdrawals here can be deadly. So it's very, very important, again, that if you are trying to detox from alcohol or a benzo, that you go get medically assisted detox. Some of the acute symptoms that are going to appear within 2 hours to 4 days of stopping alcohol include headache, nausea, tremors, anxiety, hallucinations, and delirium. And then very scary can be seizures. The post-acute symptoms, which honestly can last anywhere to 6 months, include trouble sleeping, memory problems, anxiety, low energy, intense cravings, and chronic nausea. So please, if you take one thing away from this, just know that alcohol and benzo detoxes are and can be fatal. So it's very important that you go get the assistance that you need. So the bottom line, detox followed by education, counseling, family and individual therapy, physical therapy, and support groups are key to helping an individual stop using drugs and maintain sobriety. Remember that substance use disorder is a process and it is dynamic. And so maybe this is your 5th time going through detox, and know that that is okay. Relapse is part of the recovery process, and you need to go to detox as many times as is right for you. So don't get discouraged. Don't think you're a failure. You're doing the right thing. And please always know that help is out there and that you can get through this temporary discomfort. Detox maybe lasts a week. It is brutal. No one's going to lie to you, but you can get through it. It's just a temporary discomfort. Lastly, another thing that you can try is physical therapy. So physical therapy is an option if you're choosing to detox at home. It can help you get through some of those body aches, encourage movement, and manual therapy to help ease some symptoms. So perhaps a massage might feel good, or just getting some exercise can help ease your mind, your body. It can just feel good to get moving. If you choose to detox inpatient, ask if physical therapy is an option. It's becoming more and more popular, and there are more providers out in the field. And then also know that physical therapy can help you decrease pain and stay substance free. So a lot of physical therapists are actually very knowledgeable about pain, and they know how pain is actually wired in the brain. So if you talk to someone who is a physical therapist, they can help you know that drugs are only going to increase this pain rather than getting the exercises and the musculoskeletal help that you need. And then lastly, if you're in doubt, please reach out. There's a lot of different numbers here that you can call. They have hotlines, they have websites. There's something out there at any step that you might be thinking about, or if you're ready for it, please get on here and check out the different resources that you might have. Thank you for listening, and I wish you the best.